who's also a nurse at UNMH. So a couple of things. Thank you very much for this mask. I appreciate it very much and am diligent about wearing it, and know unequivocally that I am protecting others by making sure I'm protecting you from me. And also, it's a great chance for me to say thank you for your healthcare work and dedication, the fact that you're a first responder. All of us in New Mexico are grateful for your incredible work and service. All right, I'm going to take the mask off. I think I'm going to try to do this because it's, I'll have to put it back on. All right. Again, thank you, Lindsay. It's wonderful, and I need them and wear them. And New Mexicans, remember that we are making thousands of masks and working diligently to get them out to you. A first large batch of several thousand are on their way. More are being prepared to be on their way. And we're going to work diligently as we talk about how we're phasing living with COVID-19, being in a COVID-19 world, what we do about opening up businesses and supporting our communities, and that means helping each other have access to face coverings. So thank you very much, and again, thank you for your work. All right, let's go to the first slide. We're going to do a case update. Today we have 134 new cases. That gives us a total of 6,317. You'll notice in the modeling that like most states, we're not quite seeing a decline in cases, but we are feeling good about the stability of what's occurring in New Mexico. But that means that you still have to do more, and thank you for doing that. We have 206 total hospitalizations today. We've got 58 on ventilators. That number is a bit high when we compare that to national averages, and again, because we have to pay attention, and should, to what kind of healthcare capacity and making sure we have the right equipment and resources to meet the critical care needs of all patients and COVID-19 patients. That's a very critical aspect for us to be paying attention to. Unfortunately, we have 7 new deaths today. That gives us a 283 total. And again, this is the most painful part. These are all family members and missed loved ones, and this is an incredibly cruel way to lose a family member to a vicious, invisible virus that attacks without any warning, and for so many of us, without rhyme or reason, creates the kind of circumstances where you just can't beat this virus. And our condolences go out to all of the family members who have been so dramatically affected by COVID-19. You'll hear more about tests. We've got 147,344 tests. It's important to me to always remind New Mexicans that the amount of testing we do and continuing to grow that testing is critical to living in a COVID world until we have a vaccine. We need to be able to box that virus, isolate individuals and families who are affected or who have a positive case in their household. We have to be very clear that the quicker we do that, the more effectively we do that, the more information we give to employers and to a community about how we're getting that done safely, privately, productively, then the more we're able to do to sustain a new normal while we live with this virus in our state, in our communities. All right, let's go to the next slide. Or not. Oh, there we go, sorry. This is a testing slide, so we're going to go to Kathy. I need to do a better job with our folks, just for people who are viewing, right? We don't rehearse. We want to make sure that you've got the right information and the right slides. We want to make sure that you get a testing update, you get a modeling update, and then I have other news, and I can sometimes confuse that. So, Kathy,
thank you,
Secretary, I apologize.
Good afternoon, everyone. As the governor stated, we are continuing to do our targeted testing with six major groups: long-term care, minority communities, tribal locations, essential workers, which focuses largely on healthcare workers, childcare workers, grocery stores, and utilities. We had a significant work with special populations last week, and thank you to the DD community, the home and community-based waiver providers, who tested 100% of their direct service providers by last week. The slide, please. We also had a significant emphasis on corrections, and the state has 11 facilities. The state completed 100% testing of their staff and 25% of detainees in all of New Mexico state facilities. In addition, we have moved into the counties, and 22 of our counties have also completed 100% testing of their guards and staff and 25% of their inmates. 8 counties are still in progress. We thank the Association of Counties and the county managers who assisted the Department of Health in accomplishing that goal. In addition to our work with testing, we are welcoming some new state partners in the lab capacity. This week, Pathology Consultants of Roswell has begun doing COVID testing in the Southeast. Christus St. Vincent has also begun their own testing in Santa Fe and brought all their COVID testing in-house. And we're looking forward to welcoming New Mexico State University, who is getting closer in standing up their own COVID testing. And with the increased capacity that we have in the state, we're looking forward in the next weeks to developing a more strategic surveillance system that will become part of the public health mission, much like our flu network surveillance has in the past. So I will be bringing you more information on that as our surveillance plan develops. And there are a lot of people who do a lot of work around the COVID efforts. Many of them are volunteers. I want to specifically recognize today the Medical Reserve Corps. And the New Mexico Medical Reserve Corps is a network of volunteers and communities that are organized under ASPR, which is the Associate Secretary of Preparedness under HHS. This network contributes to many things, including assisting us in extending our preparedness for our response in an emergency. And the MRC provides the structure necessary to identify, credential, train, and activate medical and non-medical volunteers. The New Mexico Medical Service Corps Coordinator, Bobby McKenzie, recently was awarded the Elizabeth Fitch Leadership Memorial Award. In addition, the MRC received an award for outstanding preparedness, resilience, and community response. The MRC currently has 70 volunteers in locations around the state, and since the beginning of COVID, they have deployed 173 volunteers and contributed over 3,883 volunteer hours. So congratulations to the MRC, and thank you to our MRC volunteers.
Thank you, Secretary Kunkel. All right, so we're going to do the modeling update, which is the information that we use routinely to determine whether or not we're meeting our goals in terms of reducing the spread of this virus, containing it, and supporting our communities and families and businesses to live in a COVID-19 world. So Dr. Scrace, I give it to you.
Thank you very much, Governor. We're going to give you an update today of case progress. I'm going to follow up on a couple things we talked about last week as well to give you updates there. We're going to talk a little bit about the role of science in decision making today as well. So if I could please have the first slide. This is something that folks got confused about last time. Some folks did anyway. We pointed out that 4.1% and plus 8.6% is 12.7% of all cases occur in children, those under 20 years of age. That and some folks took away and reported that 12.7% of all kids in New Mexico were infected with COVID, and that's not true. Actually, the highest infection rate in the state and possibly in the country is McKinley County, right now at 2.7%. So it's not 12.5 or 13% of kids that are infected. It's of all the cases, 12.7% are kids under 20, and that is the second highest in the state. You can also see the graph that I've shown you before about fatality rates for folks who get COVID with very high fatality rates in older age groups. You can see no deaths at all in people under 30, which is good news. And one thing that gets missed, and there was an article that came out about this earlier this week, is that the average number of life years lost for people who pass away from COVID is 10 years. So it's not mainly people in their last year or 6 months of life that are affected here, but it is really across the board and a 10-year average. So that's significant. I mean, think about what each of us would do with 10 extra years of life. Let's go to the next slide. We've revised this a little bit to give you even more information, but you're familiar with the orangish red line there. That's the Northwest. I told you last week that after another week, we probably would have enough data to tell us if we'd passed our peak. And we can say now that we've passed our first, hopefully our only peak, but at least our first peak for the Northwest. The next line below that, the green line, is the metro region, central New Mexico. And you can see that the Central region has actually had two peaks. We had one, and apparently more contact between individuals, and a second one that appears to be passed. I'm going to skip to the bottom two lines, which are the Northeast and Southeast. You can see small number of cases, fairly stable, a recent increase in one, but small numbers. And then the light blue line represents the Southwest. I told you we're keeping a very close eye on that last week. The number of cases is dropping on a 7-day rolling average, which is good news, positive news, but we're continuing to watch because you can see it's sort of level there from the graph, and we'd like to see it go back down. So good progress going up to the top blue dotted line, which is all of New Mexico. You can see we peaked about the 1st of May and hopefully are on a steady downhill course. This idea of reopening is tricky because it requires us to do some extra things to make sure as we spend more time with each other and have more contact with each other that we're controlling the spread of the virus. Let's go to the next slide, and we'll spend most of the rest of the time talking about gating criteria. We talked about this pretty much every week. These criteria are things that must be in place for the state to move forward. One thing I'd like to remind people that's particularly relevant right now is you can see that we're actually below our target for the whole state for the first time. We're at 1.12. That number, I'll make it easier if you multiply it by 100, is the number of people that 100 people with COVID would infect. So if we had 100 people with COVID right now, they would pass that on to 112 cases. If we weren't doing everything we were doing, that 112 cases would be 300 cases, and then, of course, those 300 would pass on to another 300. You'd have 9,000, and it would go up exponentially, but we're getting good control of the virus. Also, on the next slide, some of you may have seen this. This is our gating criteria again, but go to the following slide just for a second. This is www.covidexitstrategy.org. It maps all the states in terms of their pacing and whether they're ready to really start reopening, not completely reopen, but to begin phase one of the reopening process. And this changes every day. So I think yesterday New Mexico was yellow, the day before we were green, but it measures our progress against testing, which we're doing well on, the trend of cases, which is, as I showed you, going down, and then our hospital capacity, which is good. And I'm going to have you go back one slide now, just in that context. You can see that we have green boxes around all the areas where we're meeting our target. We have a target of 5,000 cases per day on the exit strategy. They hold us accountable for about 3,300 today, but all the green boxes mean we're doing really well and meeting the targets we're trying to meet for the most part, and feel comfortable with this reopening process. Also, just to mention that we're not going to see the effects of reopening, which really started on Saturday to a significant degree for another for 10 to 14 days from then. So we won't see those effects right now. We'll see those in the future. But doing well in all the metrics in a little bit more detail. Now we'll go to the two more slides. Sorry to jump around, but we'll go with this one. This is, we showed you that as a state, we are at 1.12. You can see each of the regions now is doing well. Metro, very good at 1.06. Northeast, 1.08. Southeast, slightly above. And this is related to a group of cases that occurred on the eastern border of New Mexico, a group of people who were traveling into Texas for recreational activities and brought back the virus to this state. Southwest, you can see we're concerned, but it's come down significantly, 1.33 last week, 1.16 this week, and Northwest now, which we've been following very closely for a very long period of time. Finally, that spread appears to be under reasonable control. And so great progress across the state. The thing that we need to keep in mind is that the stay-at-home order is the most effective tool for reducing spread because it keeps people from interacting with each other. And interacting with each other, although desirable as human beings, is what sets up a situation for the virus to spread. And so we need to make sure that with using masks and with staying 6 feet apart, that we're basically overcompensating for the fact that there's a lot more human-to-human interaction as we reopen. And that's what our data will also enable us to know as we move along. There was an editorial this weekend about whether or not we were blinded by science, and I did want to take a minute as the scientist designee to, although everybody here does awful lot of science, to kind of talk about what our process is and to make it really clear that science actually is, in my opinion, an invitation to open discussion and debate. And it's never our intention here to use science as a substitute for logical arguments or providing specific data to make decisions. So I want to make sure that was really, really clear. I also will say, though, that given a choice of using a little bit of science when we have it or no science at all, I'm proud to be part of an administration that has a bias toward using what data we have. In this COVID pandemic, the MAT team reviews 60 to 75 articles every single day. With the rush to publish, there's less control criteria over evidence, so it takes a lot more looking and in-depth research to see if these articles make sense. One example in the editorial was, hey, 8 weeks ago, Dr. Fauci was saying, you don't need to wear a mask, and then 4 weeks ago we said, you ought to really consider wearing a mask. And then last week you said, you really should, it's an order that you wear a mask. And the reason that's happening is because science is changing. And I won't go into too much detail, but that original study that I'm sure was the basis of Dr. Fauci's opinion was a single layer cloth mask used by people who worked in an intensive care unit with infectious patients. And as we know, that's not the kind of mask we use to protect healthcare workers, and they did get infected. But 4 weeks ago, some data came out that showed that those multi-layer cloth masks were protective, protects other people from you transmitting the virus and sending off droplets. We recommended them. And then about a week and a half ago, new data came out that said not only do these work, but they can save 17 to 45% of excess mortality, which in New Mexico translated to almost 1,800 lives. And so at that point, that's when they were mandated. So science changes. The central part of science is debate over the data. We're going to make new resources available to the public. We'll provide links on the medical advisory team website to that compendium of literature. And we're also going to be publishing the gating criteria now with updates where we update them 3 times a week as well. So you'll be able to look at that, see that more. And if you have data questions or are concerned that we might be using science as a hammer rather than a guide to help inform us in strong public policy, please feel free to reach out to me for comment or with specific questions. There aren't really any absolutes in science, and so always a debate, and we're happy to participate in that, and we'll be happy to bring our evidence, and you bring yours, and we'll have a spirited discussion about what can best inform public policy. Okay, end of science soapbox, and if we could now move on to the next slide, please. We'll keep talking. This is the rate of spread by region, and it's just a graph of the data I showed you. A little harder to read, but you can see most of those lines now are down below our target with just a few sitting right above, which puts us in a very, very good position, and in fact, in a better position than most states in the United States. Next slide, please. Just to show you our travel guide for New Mexico, we had that very low point, that bottom spike was Easter, and since then there's been a steady uptick in travel, and a typical high Monday, Tuesday, Wednesday, Thursday, Friday, low Saturday, Sunday pattern. We're watching that because we're concerned that the more we travel, the more opportunity there is to spread the virus. We're working with Los Alamos National Labs, who's actually adopted the New Mexico approach to this data, and they are finding strong correlations between travel and spread of the disease. So watching that closely. So enough for the gating criteria of spread rate. Let's move on to testing. Secretary Kunkel, again, expanding testing dramatically. You can see the slope of the line going up. We're stable at around 4,414 cases on a 7-day rolling average yesterday, which is a really good average, very close to our target. If anybody has a couple 100,000 test swabs out there, please let us know and send them in. That will help us get to our target as a state. I'm going to skip over the time to from testing to isolation of the case and then isolation of their contacts. We're doing very well on that. We don't have an automated system. We continue to work on that. And lastly is delivery system occupancy. And again, we're doing well there. If I could have the next slide, you'll see a graph that shows a black line, which is we're finally getting our reporting down to every day. And you can see that the 7 hub hospital ICUs, which are our critical resource in New Mexico, we're at 283 beds filled. And that, I want to give a shout out to our hospital leaders because they really only have 230 ICU beds, but they found a way to expand their capacity for this pandemic. They're filling beds above that, and we have a good margin to go before we get to what we would consider crisis care, where that solid red line is. And we would be certainly telling you more about that if that time was coming. But right now, we're doing a great job. I think as of today, maybe 285 transfers from regional areas of the state into Albuquerque for care, mainly for COVID patients. Also wanted to mention, though, that the main type of patient that's filling up hospital beds right now are people with non-COVID medical conditions. And we're starting to see a trend here in New Mexico and also nationally of people who delayed care out of understandable concern for the past couple months. But now is the time to resume that care, get your kids immunized, get your heart or diabetes or other conditions checked. We've seen a fall off and monitoring of diabetes control. And so please, urging you today to get back in touch with your provider and make arrangements for that, to resume that care now, because we don't want you to end up in the hospital or in an intensive care unit bed because that disease pattern is out of control. And lastly, we've got the PPE situation. We want 6 of our 7 hub hospitals to have sufficient PPE, and actually it's been 7 every day. One hospital or another didn't report on 3 of those days, but we do have adequate supply now, so that's not a constraint. So all in all, to summarize, we are, on the next slide, better than target on spread rate and want to keep it that way. I'm sorry, let's skip this slide. Maybe we don't have the, do we have the summary slide in there? Do you know? Okay, we don't have a summary, so I'll just briefly go over it for you before I turn it back to the governor. Our spread rate's better than target. Testing still significant improvement, better than national standards, a little short of the New Mexico standard, but we're getting there. Send us your swabs. Contact tracing is being automated, but we're very close to where we want to be there. And the delivery system capacity is on target. Again, though, remember that the social distancing measures really are what's controlling the virus. It's though if we had jumped out of an airplane with a parachute on and we're gradually descending and finally started to slow down and drift towards Earth, but we're still maybe 1,000 feet above Earth, we would not conclude it was time to take off the parachute. It would be time to continue that slow descent and prepare for a landing in a COVID positive world. Just the same, we're not ready to completely reopen everything. We have to go slow. We have to look at data. We have to give ourselves a couple weeks between steps. Meanwhile, stay at home, particularly if you're a high-risk individual. Wash your hands, clean off surfaces, cough into tissues. Wear those face coverings in public and keep those 6-foot distance to help us adjust to more human interaction. And I think we can slowly make it to a place where we can balance reopening our economy step by step and keeping the disease under control. Thank you very much, and I'll turn it back to the governor.
All right, thank you, Dr. Scrace, and I'm really happy that that happened to you too. It makes me feel like I'm not the only one. We want to make sure that when we're talking, you can follow along and see the data. We're also clear about getting it on to all of the COVID-19 websites, whether that's a direct Department of Health website or it's a New Mexico state government website. And again, we don't want to be flip about how we present this information, but we do. It's an earnest, day-to-day effort to make sure that we're updating every single dashboard. We're looking at not only what the current cases are, but the trends. And one of the reasons that both Dr. Scrace and Secretary Kunkel's information and presentations when we do these press conferences are so important, because it meets that overall 4-part gating criteria, which is how we make decisions. And in that one slide that showed New Mexico as green with Michigan, that gating criteria is widely held. Not every state has the same measures for what they identify as gating, but it's a commonly held, you need more than one data set to determine where you are given the rate of transmission, the impact, your ability to isolate the virus, that you have got every state's got a different healthcare capacity response. So how you determine what those measures are, and then really holding. Now, here's the interesting thing that the entire country, frankly, is engaged in, and New Mexico is no different. There are two things going on, and I'm almost ready for the slide because I have to cue them because we just go off script, and we should. This is a dialogue between us and New Mexico about where we are and where we're going. All right, so the White House, and in my opinion, rightfully so, several weeks ago said, look, as we make decisions to reopen the economy, two reasons, right? We've got significant economic losses that must be addressed. And two, we've got constituents who want access to any number of services. Those are real issues. They can't be either or in terms of public health and safety. So what can you do that allows you to create circumstances, right, like COVID safe practices and masks and slow openings and reviewing the case numbers and related gating criteria? What can you do that gives you confidence that you can open? So the White House says, when you have 14 straight days, which is basically, right, that quarantine, incubation, and isolation number of days that the CDC identified, then when you have 14 straight days where your cases decline, then you can safely begin to reopen your economy. And that means it's staged. Well, no state met that, including New Mexico. Now, states decided, for any number of reasons, and they are free to do that, to reopen in whether or not they meet their own gating criteria, or, in fact, in lieu of CDC initial guidance about what was safe, which the White House initially adopted. So the problem with that for us, not only as policymakers, but for New Mexicans who are working hard to adhere, right, to these new practices and living in a COVID-safe world, is absolutely, it's got three major issues I want to talk about. One, that there's a real social isolation aspect, and I want to talk about behavioral health, and a sense of hopelessness about, if we don't have a vaccine, is it ever truly going to be safe? And so we want to mitigate those risks, and we want to give people confidence that we're doing that in a safe, prepared, productive way. Two, that we're going to realize that if we stage these openings, that we keep people safe by making sure that the data points are holding, so that you don't overwhelm your first responders or your healthcare systems, so that you're really clear that you don't have to go backwards. I mean, the worst thing for everyone, not just businesses, but consumers, is to open up and then have to shut everything down again. So making it slow and steady, not so slow that you don't have any hope or realize that we have an impact, but slow enough that the data follows our decisions, that we can tell you the impact of those decisions. And then last, In fact, geography does matter, and because people do travel and we want statewide decisions because we know people travel, we want to try to frame these in terms of what's going on regionally. I want to show you why other states' activities do have an impact on New Mexico's ability to stay the course and show that we're making real progress. So let's look at the slide that talks about Texas and El Paso. It's just the slide after this. There we go. So we're not picking on El Paso. The mayor of El Paso and I have been in contact with each other. We're working together. I can tell you that that mayor and other local elected leaders are working with Doña Ana County elected leaders and Las Cruces leaders. And of course, I have the opportunity to work with Governor Abbott. But El Paso is an area that's basically comparable to the size, not just of Albuquerque, but all of Bernalillo County. Now, the cases and related mortality deaths are rising in El Paso. Yesterday, there was a 39% increase in one day in hospitalizations in El Paso. So the COVID-19 spread in El Paso poses an incredible risk to Doña Ana County and therefore the entire state of New Mexico. So you might remember, and Dr. Scrace will correct me if I use the wrong language related to this, but there are two issues, not just the rate of transmission and spread, which is critical, and we use that as gating, but it's also the prevalence. If this virus is spreading so rapidly and is ravaging a community or a population, then the likelihood that you come in direct contact with it in a number of places, open businesses and restaurants and entertainment and workplaces and grocery stores and gas stations and convenience stores and parks, gets higher and higher and higher. And if you're traveling between an area of that nature and New Mexico, you're increasing risk. And so just because another state is reopening faster is not an indication that faster is better. Faster means that you can contain the virus and that they're not going to have to make really tough decisions. Like, for example, now they're treating El Paso differently in Texas in terms of its reopening because they've got a containment issue. And I appreciate that decision making by Texas, but there are still far too many things open in El Paso that may not quite be ready to be opened in New Mexico. And if we aren't careful and we aren't clear that people move between communities, we spread risk not just to Doña Ana County, but you spread risk to every other county in New Mexico. So these are things that we are also paying attention to. So we're looking at what's happening in Texas and Arizona, our neighbors. And I want to make that point. I want to hit that hard. Go to the next slide, because New Mexicans get really frustrated. But I can go across the border, but you are exposing yourself and other New Mexicans to risk. And until there's a vaccine for this nation and all states meet their gating criteria, we have to be cognizant about the controls that we can put in place that keep New Mexicans as safe as possible and allow us to keep opening businesses without having us to take a step backwards. That's what's critical. All right. So what should I be doing? I know that we seem like this is harping, and that's not our intent, but it is really important. Stay home. Except for work, your basic needs, which we've identified as urgent needs. People need fuel, people need food, people need medicine, and emergencies. Wear your face coverings. I want to give New Mexicans a shout out. By and large, they're wearing them. I know that there's some political discourse around the country. For us, it's not about politics. This is just about making sure that I keep you as safe as possible, and that allows us to live in a COVID-19 world. That's what we're doing. Keep 6 feet of physical distance in public spaces. You might note that I keep saying that we're at least 18 feet. Somebody finally measured, so we're about 11 feet apart, but well beyond the 6 feet of distance. Social distancing is critical. It is another mechanism that allows us to prevent spread by doing our part. Don't congregate in groups. Don't do it anywhere, at parks, on hikes. And when I go out for groceries or to run, to do the things that I'm asking everyone to do, right? I'm staying at home, except for work, like today, where I can telecommute, I do that. But if I need something, I wear my mask, I take all the COVID safe practices, and I really support businesses in Santa Fe that are also maintaining the best COVID safe practices, right? Doing everything that they can. And I notice behaviors that just aren't quite there. A couple, one person wearing a face covering, another person not. That as people are waiting, they're way too close together. They're not 6 feet apart. I know it must be very frustrating while you're waiting in line. I don't want to give myself away about where I was, but working on your takeout, it just seems way too comfortable to keep getting closer and closer as you're in line. Try to resist those behaviors. In grocery stores, inside the grocery store, everyone practicing to the highest degree COVID safe practices right outside. People are removing their masks and their people are right next to them, including workers. And every time you're touching your face covering and you touch your face, you're creating risk and potential spread. So don't do it. Really try to change these behaviors, and they're hard. If they weren't hard, we wouldn't keep reminding you. Support your local businesses. Look, we're creating this opening and this phased in and limited approach. There is no local business who isn't suffering, not one. Even with the metering, right, and taking our time and changing and expending more resources for face masks and coverings and different ways to do things in grocery stores, right? These are expenses that they didn't have before. Do everything you can to support our local businesses and our local economy, while at the same time recognizing that it's not an invitation to be out and about in ways that create more risk. I realize you're going to have to help us with those balances, but it's really important. BuyNMLocal.com is a place that you can go to really see where you can support local businesses. All right, let's keep helping each other. This is going to be a long summer. We're going to be opening up. We're going to be showing that we can do that safely. We're going to be reminding you. All of the public health experts, not just in the United States, but around the world, are predicting that in the winter, pre-vaccine, we could have another surge of this virus making its way around the country. And as that happens, it doesn't disappear until then. It's just when we expect, like flu season, really knowing, as learning more about this virus. Assuming that happens and following the healthcare experts' advice, everything that we do now, every behavior change, right, means that we wouldn't have to close our businesses. That is critical to not only New Mexico's health and economy, but to our safety and well-being. So let's really do that. So what can you do? Help your neighbors. Offer to shop for groceries. Make face coverings if you have extra fabric or other resources. Encourage them to contact us so that we can get them a face covering. And this is really important. I'm going to talk a little bit more about this in a minute. Reach out and stay in contact. We know that isolation, right, these stay-at-home orders, not only are important and valuable to manage the spread of the virus, but they create real impacts on all of our behavioral health. We're not seeing our families. We're not seeing our coworkers. Our children are not seeing their friends and their teachers and folks that they count on in their schools. This is a significant issue. They're not getting to do their sports. We have to be cognizant that these are real behavioral health risks. So reach out. FaceTime your neighbors and your friends and your colleagues, your coworkers. Make sure that we're really doing our part to engage to the highest degree. And then monitor yourself and your families for symptoms. This is really not about behavioral health, but I'm going to make it about both. We want more people to get tested. I'm going to talk about something I didn't talk to my team about, but we mentioned it a couple weeks ago. Facebook has an app where you can sort of get on if you think you've got symptoms and really go through them. There are hospitals now around the country that are really limiting their exposure and and really enhancing their containment efforts by making sure that every employee has an app where they monitor themselves for any symptoms: cough, fever, sore throat, nausea, headaches, loss of taste or smell, and any number of emerging symptoms that are really important for you to evaluate, because far too many individuals don't think that they are symptomatic, and they are. And then, of course, get tested, because there are also a significant percentage of the population that doesn't have any symptoms. So we just want to make sure that people are really engaged in getting tested. That's the kind of surveillance that we need. And then monitor yourself for behavioral health. If you don't feel right, think you might be depressed, feel lonely, anyone in your household, then we want you to reach out for support. And I believe we've got a slide that's going to talk about that. So let's go to the next slide. I'm ahead of myself, so let's do that. That's great, perfect, then we'll go back. So here's some behavioral health resources we really want you to know about. So NM Connect app. All right, I talked a little bit about apps. Here's a New Mexico app. It's downloadable through the App Store and Google Play, and it directly connects to or texts a counselor or a peer support worker. This is an incredible aspect of making sure that no one should feel like they're in this alone and that they don't have access support to help navigate the isolation and potential depression that we're all feeling. New Mexico Crisis and Access Line. This is 855-NM-CRISIS or 855-662-7474. This is a statewide mental health crisis line for anyone who's concerned about suicidal thoughts, substance abuse, grief, and other behavioral health issues. We really want people to have these important lifelines. We all need this, and we want to make sure that folks know that there's a statewide mental health crisis line. We also have a healthcare worker and first responder support line. We don't want there to be any wrong door, but we know that there's a unique set of circumstances and specific behavioral health risks that occur in healthcare workers and first responders in this pandemic public health crisis. That line is 855-507-5509. One more time, 855-507-5509. And then we have a peer-to-peer warm line. All right, this is assistance and an understanding ear to New Mexicans who just want to talk to someone about their own mental health, substance abuse, or recovery. Again, really no wrong door, but we want people to feel like they can reach out in any number of ways and that there's someone available to you to just talk you through what you might need or what's available, and to make sure that if you determine that you need to see a healthcare professional, that we have any number of vehicles to make sure that you have that behavioral health support as well. All right, I think we're going to go back a slide, which is, okay, what else would help with that sense of isolation, right, and that feeling like we have no new normal? Well, we do believe that addressing economic issues and giving people a sense that they can engage in a more social way, keeping COVID-safe practices intact, that we are on track for a June 1st dine-in for restaurants and reopening salons, gyms, malls, and other services. And as we're looking at information, right, we might come to you even earlier, but right now we want you to know that there's nothing that we're seeing, even though we had an increase in cases today, largely related to a high-risk area, that we don't believe that we aren't going to get to our targets exactly when we should for how we can have safe reopening. All right, so restaurants, salons, gyms, malls, and other services, June 1st. How do we get there? All the things I already said. Reduce the spread of the virus. We keep the virus at bay. We keep socially and physically distant. We wear face coverings. Then it means that we can stay on track, give ourselves a little break, and support our local economy. All those things are really important, and they can be done if we do this well together. Stay healthy, protect your first responders and your healthcare workers and hospital resources, and you do this by taking personal responsibility and respecting every New Mexican who is anxious for a safe, viable, gradual reopening. I want that too. It's really important, and we're getting there thanks to you. All right, and we're following the public health data, right? I'm not looking at Arizona, I'm not looking at Texas, I'm following our public health data, but I'm recognizing that they've already had to go back a couple of steps in some of their communities and counties. We want to keep moving forward. That's a much safer, much more productive environment for New Mexico to be in, and we're doing it. We're on track. So I want to thank you for doing your work. I want to thank you for working hard, for staying safe. I want to thank our first responders, including grocery store workers and childcare workers, everyone that's making this system move and is giving us the opportunity to keep ourselves, right, safe, and to allow us to get our personal needs met while New Mexico lives in a COVID-19 world. All right, I want to thank you very much for tuning in and doing your part to make sure that we stay on track and meeting the gating criteria. I want to thank Secretary Kunkel and Secretary Dr. David Scrace, because the testing work that we're doing is incredible. The tracing work that we're doing and the automation efforts and the training of new personnel, those are the two things that allow us to manage this entire effort for the life of the pandemic, which by all accounts is at least the next 24 months, could be as much as 18 to 24 months until we have a vaccine. So let's keep making progress, New Mexico. That's my commitment to you, and I know that you're doing your part. Thank you. And with that, Nora, I think we're ready for questions.
Thank you, Governor. All right, folks. First, I'm going to go to Dan Boyd with the Albuquerque Journal. Dan, you're unmuted. Go ahead and ask your question.
With that, Nora, I think we're ready for questions.
Thank you, Governor. All right, folks. First, I'm going to go to Dan Boyd with the Albuquerque Journal. Dan, you're unmuted. Go ahead now.
Yes, good. Thanks. Good afternoon, Governor. Two quick questions, if I could. First, there's been some national reports in recent days about speculation about the vice presidency with Joe Biden, and wanted to see if you could comment at all about that and tell New Mexicans about kind of what the latest is. Secondly, wanted to see if you could provide kind of an update on special session preparations and where things are on that issue.
Thank you. Yes, there is flattering news about a variety of incredible women around the country, and I appreciate the recognition of the work that we're doing in the state and in my experience. But our communication with the Biden campaign, because it's primary season, is about, endorsement and making sure that we're working on getting folks ready to go to the polls. And I'm committed, as so many other Democratic governors, to make sure that we have a President Biden, not just a Vice President Biden. There's no question that given my leadership role as the chair-elect of the Democratic Governors Association and any number of other efforts to engage particularly minority voters, not just in our state, but around the country. We're working diligently to make sure that we're providing whatever support is necessary. And the rest of it, I think, is just that. Political speculation, and while flattering, irrelevant, about making sure that I focus on doing my job as a governor and where I can be helpful in terms of motivating a political response for what I believe would be the right president, given the conditions that this country is facing. Will continue to do that political work as appropriate and as diligently as I can. Special session. We are going to start the special session on June 18th. That's a Thursday. We expect to be done over the weekend. And